I was bent over for a long time. As the years went by, it just got worse and worse. I couldn't lay on my back at all. Basically nothing I could do because I was just so bent over that I couldn't stand straight. It was bad. It was really getting bad. So my son said, "Ma, you got to get help." So we decided to get some help.
She's usually a happy, laughing person, but when somebody feels like they're not how they're normally supposed to be, they're probably not going to present themselves the same way. There's times where she could go to parties, cookouts, and other situations she doesn't feel comfortable going because she feels like she's hunched over and she don't want people looking at her. So I feel like it definitely affected her confidence.
I didn't think there was any help. I didn't think anybody could do anything about it. I tried everything, every doctor, MRIs, exercises, nothing helped.
So Eloise has an incredibly complex problem in that she had a combined severe spinal deformity with a hip flexion contracture. These cases are rare of this severity, but we're well equipped to take care of them here.
How are you? How you doing?
I'm doing good.
Hey, buddy. How are you?
Nice to see you. They told me they could help me. They was glad to see a patient like me. So I said, well, I'm down with it. If we can do this, we can do this.
Me and Dr. Diebo were extremely excited when she came in because for us, we love a challenge. We love the most complex cases that there are. And so when we saw her, we know that there's almost no one out there that can treat her like the way that we can and like the way that we did. So we were very excited for the opportunity to be able to fix her. And she had gone to doctors for years and years and nobody else could fix her.
Me and Dr. Daniels have been really doing extensive research about hip spine syndrome in the past few years. So we knew what she needed the moment we spotted the x-rays. We knew what's the problem. And that what excited us the most.
I had confidence in them the minute I met them, me and my son. I said, yep, these are the two to do it. If anybody's going to do it, they will.
They knew what they were talking about when they came in. They weren't scared of the situation. They weren't hiding any details. They let us know off rip all the consequences that could possibly happen. Like, rather than telling us the good, they told us everything bad first. So then it gives you better understanding.
Hip spine syndrome is basically when two pathologies happen at the same time, at the spine level and the hip level. And they both contribute to the inability of patients to stand up straight. It's really complex in terms of the dynamic between the spine and the hip. If the spine goes a certain way, the hip will react to it.
The way we've adapted to take care of these problems is with a two attending approach, where we have two attending surgeons who work together. It helps us to work efficiently, it helps us to keep the patient as safe as possible, and it helps us to get the best outcomes we can.
Orthopedic surgery has been subspecialized a lot. So, spine surgeons see patients on their own, hip surgeons see patients on their own. The actual spine realignment procedures that she had is established science. It's proven to work. The actual hip procedures that she got also in itself is established as a safe and efficient procedure. But for them to be done together, because both diagnoses were actually established by the same surgeon, is the first of its kind. The key to it is just diagnosing it, knowing it exists, and knowing that if you just do an isolated spine procedure, it will catastrophically fail, for sure.
Can you stand up taller?
I feel like a new person. Yeah, I feel beautiful. I mean, in the beginning it was a lot of aches and pains, but it's worth it. I'll be able to do a whole lot of things that I never did before, like walking in a grocery store without sitting in one of those little scooters. I can just push a buggy. There's a whole lot of things I can do myself now.
She was able to stand up straight 2 days after the last surgery. And the moment she saw me, she said, "I've never stood up like that in the past 5 years, and this is awesome."
I can't tell you how happy I am. It's changed my life, and my son too, because he helped me to be strong. He gave me the push to do this. He stuck by me 100%, and I love him to death for it.
I would encourage people, if they're in the same situation, to not be scared. My mother's a lovable person, so probably has 500, 600 people praying for her every day. For her to be in that type of situation that she was in and to come out on top, you have to have some type of faith in the doctors as well. You have to believe that they know what they're doing. You have to believe that they're making the correct calls. You have to believe that they understand their patients and they understand what it takes to get them to the next level. I would give them a 10 out of a 10 star. Like, I'm not an easy grader either. I'm gonna be honest, you feel me? Like, they definitely know what they're doing. I appreciate them.
Her reaction to it is so contagious. She's happy, and I walk in and I'm happy, and we're all like kind of just excited to see how her life changed.
It's a wonderful gift to be able to give someone their life back. She thought it was over. She couldn't do any of the things that she loved to do, and to be able to provide her with an upright spine, an upright posture, and a pain-free life, she can now go back to living the life she wants to have.
When she's strong enough to be able to move around, and there's multiple different places in the world that she can visit, explore, see all the blessings the world has to offer.
You definitely have to have a team, because you can't be negative and think you're going to do it. You can't. You have to be positive. Thank you, doctors, and whoever else put a hand in it. Thank you from the bottom of my heart. God bless you all.